All right, so confusion continues to grow around the AstraZeneca vaccine as Ontario hitting pause on those first dose rollouts of the shot. And understandably, a lot of people have questions about it and the overall safety. So let's break things down. Plus, we're going to look ahead to the possible extension of the stay-at-home order with infectious diseases specialist Dr. Sumon Chakrabarti. Good morning to you.
Morning. Thanks for having me.
Thank you for joining. I want to begin here with the anticipated announcement. Premier Ford, as of noon today, we are expecting to hear an extension on this. From your perspective, is this a good move? We're hearing it could be a 2-week extension.
Yeah, I think that right now, based on what we're seeing, so first of all, yes, the numbers are going down, which is very encouraging to see, but we still have to decompress the hospitals, especially the ICUs in the GTA. We're still transferring patients over, and I think it's important for us to address this as soon as possible. I think it's still going to be another 2 weeks, but in June, I expect to see things start to come down and, some of these restrictions lifted.
Okay, I'm glad you said that. When it comes to restrictions, the conversation, obviously, a lot of people saying transmission lower in outdoor activities. Do you think any of that should be lifted?
Absolutely. And I think that's the concession that's going to be given on the 20th when it's extended, is that outdoor activities hopefully will be open. The risk of outdoor transmission is vanishingly small. And I think we really need to give people safe alternatives, what they can do. Weather's getting amazing right now today. So we really want people to be outside. The risk is not zero, but it's much smaller.
All right, let's get to AstraZeneca. So putting pause on that first dose for AstraZeneca, and we have more doses coming in to our province. And I want to address this one. For anyone who got their first shot of AstraZeneca, we've heard from the province saying you should feel confident in that. But now what? Early results coming out of the UK saying they're seeing some side effects with that mixing. What do you think the province should do? Obviously, we have to wait on these results to see what makes the most sense. But what do you think should be done with the vaccines that are currently sitting here, 50,000, and the ones that are coming?
Yeah. Sure that these were going to be reserved for second doses, but I'm not sure if that's happening anymore. Maybe it's going to be given to other countries that need it, such as India and other countries in South Asia. I suspect that the UK trial is going to be positive, allowing for that second dose of Pfizer for people who have had AstraZeneca. But I want Canadians to know that the people who got AstraZeneca, you got a good, amazing first dose of vaccine. It's safe, and you're going to be eligible for a second dose as well, either AstraZeneca or likely Pfizer. But the point is you will be protected, and I don't want anybody to regret that they got the first dose, because part of the reason that we're here in this good situation is because people got vaccinated.
We just pulled up a fact sheet up there, and I'm hoping we can pull that back up because a lot of people have been asking about those numbers that we've been seeing. So far, 8 cases of, and I don't know how to pronounce it because you're the doctor here. We just short form it as VIT. This is the blood clot disorder that a lot of people are mentioning. In Ontario, so out of 850,000 AstraZeneca doses administered, so putting that into context, right? But if we could look at some of the symptoms, because that 4 to 28 window, if someone got that first dose of AstraZeneca and they've hit that 28-day period, should they feel like they are in the clear?
Absolutely. And the thing is, I also want to really stress that this is a rare complication. So I don't expect people to be, counting the days, because it's something that happens very, very seldomly. But that said, yes, that's the window that we've been seeing it in cases that are around the world. And generally, it's something that's presenting with very severe symptoms, a really acute, hot, fat, red leg, or a severe headache, the worst of your life that's associated with vomiting. It's not very common, but when it happens, it's something that you should seek medical attention for. It can be treated.
Very quickly, I want to confirm the numbers. The UK predominantly using the AstraZeneca vaccine. If we could pull that graphic up for you to give people some context on how many doses were given out and the links to this blood clotting disorder. It shows it is significant in that it was effective. It was an effective use of this vaccine, yes?
Absolutely. The risk-benefit ratio really favored to giving it. Tiny risk, it was something like 10 in a million or 1 in 100,000. The point is that it's a safe and effective vaccine. And right now we have the luxury of using Pfizer. That's the reason why I suspect that they have discontinued it. But I don't think we've heard the end of it. I think we might be seeing it again in the future.
Okay. A lot of great information here, Dr. Chakrabarti. I appreciate your time. Thank you.
Great. Thanks for having me. Good to be here.
Good to have you. All right, 8:09, and hopefully that provided a lot of information for our viewers here and put you at ease. Steph, good morning to you.